It's Dr. Doug Smale from Digital Dental Surgery. Today's video is part one of a two-part series on Nobel TempShell, an exciting technology to help make implant temporaries a snap, literally. I'm going to share some of my previous frustrations with dental implant temporaries, plus show you how Nobel TempShell solves these problems. Hopefully, you'll learn that making implant temporaries can now be easy, consistent, and really provide a great service for your patients.
I would love to temporize implants, especially in the aesthetic zone. Gingival contours are better preserved, success rates are as good or better than the two-stage approach, the total treatment time is reduced, and patients are happier than with a flipper or Essex appliance. So why not temporize every case? First, it's a lot of work. Second, screwing the abutment on and off several times sometimes loosen the implant. Third, unless it was fully guided, you were never sure it was placed in the correct position and angulation. When do you place an immediate implant? You have to understand that three things can happen. Only one of them is good. On the bad side, sometimes the implant can't be placed immediately. The buccal bone is gone, it's a difficult surgical extraction, or insufficient insertion torque, otherwise known as a spinner, happens, then you'll have to graft and come back in 3 to 6 months. Okay, so you've got the buccal bone and you get the implant in place, but you only have 20 to 30 Newton centimeters of insertion torque or a low ISQ. You can't immediately temporize that implant with confidence. You better have a backup Essex just in case, but that means a lab bill for something you're going to throw away. Ouch. So this is the sweet spot. The implant is in and solid enough to restore. So out of the three things that can happen with immediates, two of them require a backup Essex or flipper. That's a pain and a big waste of money. An ideal temporary would function in all three scenarios. That's what's great about Nobel TempShell. If you can't restore it, the wings stay on and you can bond it like a Maryland bridge. What are some other characteristics of an ideal temporary? You want something that snaps in and out with no screws until the end so you don't torque out the implant. You want it to index well so that it stays and goes exactly where you designed it. And you don't want to have to freehand the temporary from nothing. That's too much time and effort. The shell part of the TempShell makes this so much easier. Next, here's a video clip from Nobel. So what do we need to get started? A CBCT. As shown in this case, you need to be 100% certain you have enough bone to start with. Now look at the undercut in this case. There's no way you could place an immediate. You need then stone or digital models. In photos, I do lips at rest, full smile, and then the cheeks retracted, to show all the teeth as a minimum. Need to take a shade, of course, and all this is sent to a Nobel certified lab to plan and make the TempShell. Now, when you're planning these cases, remember there's some basic surgical principles for immediates. First, we want to have the implant towards the palatal, although it could be centered if you have at least 2 millimeters of buccal bone plus gap to graft. Second, if possible, it's better to have bone apical to the root being extracted to help lock the implant in. Third, make sure you place it subcrestal so you have good bone support and support for the emergence profile. Here's a sample case to see the workflow. First, I do a CBCT to make sure I can even do the case. I'm sure all my surgical parameters are set. I send that to the lab along with the CEREC scan, photos, and a shade. As you can see from the workup, we have everything else set. Here are the initial photos. You can see that the fracture number 9 is labially malpositioned, and we don't want to duplicate that in the temporary. Thankfully, he has a favorable smile line. The fractured tooth is then removed atraumatically. The snap abutment is then placed and checked. The temp shell on top is indexed, and then composite is used to pick it up off of the temporary abutment. Composite is then added to bring it down to the margin, and then you polish it to make sure you have a good emergence profile. And then you cut off the wings and screw it into place. This last photo is the 1 week post-op. Look how well the papillae are preserved and how healthy the gingiva is. This is going to be a great case. So what do we need? All the things shown below. We'll have this list in greater detail posted on our digitaldentalsurgery.com website. The next video will show you the step-by-step workflow in great detail from a clinical and lab standpoint. I hope you enjoyed this video. Don't forget to like, share, and subscribe to our channel. Thanks for watching, and we look forward to your comments and emails.